Okay, good afternoon. After 6 months of this pandemic, I understand how people feel exhausted with thinking about it and coping with its impact. We're not yet able to make COVID-19 a part of our past, but we have a lot more clarity about how we can get to that point. Today I want to talk with you about the direction of our country over the next 6 months. This is not just about how we will live with the COVID-19 virus, but also how we will work to renew social, economic and cultural life. 6 months ago, the world was confronted with a dramatic new pandemic, about which we knew little more than the fact that it was deadly and rapidly spreading. As our schools and workplaces closed, people didn't know what to expect. We all felt fear and uncertainty. Through a collective national and international effort, the virus and its impact were first controlled and then reduced significantly. Ireland, just as other countries did, began a process which intended to reopen activities in stages. But as we moved through the summer and away from the lockdown period, something became very clear. The threat posed by the virus continued to change, and policies had to change in response. We understand the frustration which people, and businesses in particular, felt when limits were kept in place or introduced. But without this action, we would have seen even higher levels of infection than we currently have. At the same time, our country has been able to achieve some really important progress. Schools have reopened in one of the most complex policy and logistical challenges they have ever faced. And we're all delighted that our children are back playing in the schoolyards. The economic stimulus package is making a very real difference. We still have a way to go before we fully recover, but just for example, in the last 11 weeks, over 200,000 people have been able to come off the special pandemic payments back into work. Taking account of all COVID-impacted jobs, the unemployment rate has fallen from 23% to 15%. Most of all, we have been able to reconnect with our families and friends and to once again experience our own country. Until there's an effective vaccine and it has been widely administered, we must continue to live with the reality that COVID-19 is potentially deadly, causes long-term illness, and we must limit its spread. When the vaccine is available, we will move quickly to implement a widespread vaccination program. However, I want people to understand that even before then, we can go much further in opening up economic, social and cultural life in our country. We can do this if we work together in implementing the comprehensive plan which we're launching today. This is a plan which gives clarity about each of our responsibilities and how different situations and sectors will be handled. It includes concrete measures which address both well-established and emerging issues. It shows how we can limit the impact of the virus while keeping our schools open, protecting and expanding employment, reopening services and supporting social and cultural activity. This plan truly represents a whole-of-government approach. And I want to thank everyone who has contributed to it, and in particular I want to acknowledge the work of the public health professionals and all frontline staff who have done so much for our country. The plan is broad and comprehensive, but it has 3 core pillars: protecting health, strengthening employment, and supporting communities. Underpinning this is a new approach to the ongoing management of the COVID response and clarity for people about what will happen in different scenarios. Protecting public health remains an absolute priority. The plan sets out the clear public health guidance which we should all follow. We must never forget the fact that the virus is still here and each of us has a personal responsibility to try to limit its spread. This new phase involves the introduction of a new framework for restrictive measures. There will be 5 levels of response to different levels of threat from the virus. Currently, every county is at level 2 restrictions. Our collective effort is required to get to level 1, while we wait for a vaccine to be developed. There will be a heightened system of monitoring and enforcement to guide this rapid and targeted response to outbreaks. And we will move decisively to address the fact that there are other health concerns which must be addressed. The Government has decided today that the existing public health restrictive measures, as amended in line with the new Level 2 framework, will be continued for a further 3-week period. The current COVID numbers in Dublin are very worrying, and the Government has also agreed today to introduce additional measures based on the recommendations of NPHET to suppress the spread. And I would say to the people of Dublin and indeed the country, rising rates of infection can be reversed by concerted public action and by all of us adhering to the guidance and taking this personal responsibility. Today the Government also crucially approved a €600 million winter initiative package to develop and protect our health services through what will be a very significant period of challenges up to next March. This plan shows how we will strengthen also business and employment as we live with COVID. Key business supports will remain in place until March 31st next year. The pandemic unemployment payment will now be open to new entrants to the end of the year. And a series of local activation measures will be put in place. There have been no restrictions currently on persons coming into the country, as we do need to keep travel routes open in order to stay connected and to keep supply chains open. The Government has decided to broadly support the European Commission proposals on travel as the best way of achieving this. So we will continue to engage with Member States and the Commission to finalise an approach which is consistent with public health requirements while supporting our needs as an island. In the interim, the current Department of Foreign Affairs Travel Advisory Normal Precautions list will be updated in line with this new proposed European framework. The third pillar of the plan is about helping our communities. Local well-being initiatives will be supported. And we all recognise the role of sport in building our sense of community. The Government has agreed to allow limited crowds to attend sporting events under specific conditions. During this pandemic, the absence of live arts and culture events has reminded us again how important they are to us as a people. Creativity has never been as important, and we understand the huge impact which has been felt by all who work in the arts sector. This plan allows access to theatre, cinema and music events in small, controlled settings. There is simply no doubt about the negative impact on mental health of this pandemic, and the plan proposes to implement a national approach to increase mental health supports. Underpinning the measures in this plan and the new framework for deciding on restrictions will be a revised decision-making procedure. NPHET will remain as the key body providing public health advice to government. And I want to say once again how much I value the work of NPHET and the urgency which they show at all times when seeking to protect the Irish people. In addition, a new group chaired by the Secretary-General of my department will coordinate proposals for acting on public health advice and implementing measures, and permanent coordination between departments will be enhanced. This is a comprehensive and detailed plan for how we will respond to the ongoing threat of COVID, limiting its deadly impact and allowing us to move forward as a country. It puts in place a framework for rapidly managing outbreaks when they occur. It shows how we can restore more of our economic and community life. It sets out our determination to strengthen our country's recovery. During the pandemic, there's been a lot of reflection about our resilience as a country, because COVID has had many sides: medical, social, economic and cultural. And it's only human to feel deeply the downsides, the deaths of spouses, relations, friends, many in the harrowing circumstances of being isolated from their loved ones at the end of their lives. But it has one great positive side also. It has probed and tested our personal and national character day after day, week after week, over 7 long months. But it has found no weak spot, no failure of nerve, no lack of courage, either in our people or in our society. We have overcome much bigger challenges in the past and will also overcome this challenge. Because resilience isn't just about standing strong in the face of a challenge. It's also about knowing what you value in order to protect it. It's about being flexible. And it's about working to build back better and stronger than you were before. We have set out a clear plan for the next 6 months when we will both manage the virus and continue to rebuild key services and supports.
Thank you, Taoiseach. 6 months ago, I first spoke to you about the coronavirus. Since then, we've been through a lot as a country. There have been days of fear as well as days of hope, reasons for optimism as well as days of suffering and loss. Although some of the faces delivering the message may have changed, the essential message remains the same. By doing the right things, we can protect each other. From the beginning, we knew we were in this together. Now we need to know that we can get through this together as well. I know many people are feeling frustrated, impatient, even anxious, and we all want to be able to plan our lives. And so many of our livelihoods depend on having certainty about the future. Unfortunately, nothing is certain about COVID-19. It cares little for our plans. However, we have reasons to be hopeful as a country. We're guided by all we've learned about the virus in the past few months. And we have confidence that we can do this because of what we've learned about each other. We've changed the way we live, the way we work, and today's plan sets out steps to keep the virus under control, how we can anticipate and understand how to live our lives for the next 6 to 9 months. And where setbacks occur, the steps that will be taken to reduce the risk of COVID-19 spreading out of control. So this is a plan to protect you, your family and friends, our community, our jobs and businesses. Throughout this pandemic, Irish businesses, large and small, have shown remarkable grit, resolve and adaptability in the face of unprecedented challenges. Business models have changed, premises refitted, staff retrained, people are working from home. And all of us do understand the deep concern that business owners have about the potential of business failure. So economically, our focus is to help businesses to open, stay open, to keep staff on and customers safe. And the government has and will continue to back enterprise and protect workers as best we can. As you know, we're backing business with wage subsidies, targeted tax breaks, cash grants, low-cost loans. And where local restrictions have been put in place, government has responded and will again. In the budget and the National Economic Plan, the government will review existing financial supports for business, paying particular care and attention to businesses mandated to stay closed and sectors that have been disproportionately affected. Recognising the impact on workers of future business closures and local restrictions during this pandemic, the pandemic unemployment payment will not be closed to new entrants as had been planned, nor to those sadly laid off for a second time. For most of the country, today brings some good news. In 25 counties, pubs will open on September 21st. 50 people indoors and 100 people outdoors will be able to gather in controlled environments, 200 in large stadia. For one county, it's a little different. So I want to make a special appeal to the people of Dublin. The situation in our capital is worrying and has deteriorated in the past few weeks. The level of the virus circulating in our city and county has increased more than tenfold in the past 2 months. The positivity rate is around 3.5%, against around 2% in the rest of the country. If this continues, it may not be possible to keep the virus out of our hospitals, nursing homes and factories, no matter how hard we try. We'll experience a second wave of hospitalisations, people needing admission to ICU, and sadly more deaths. Perhaps the virus has become less deadly. Perhaps we've just got better at treating it and at shielding the vulnerable and the elderly. Perhaps, as some speculate, a second wave will be much less serious than the first. But speaking as a Dubliner, I don't want us to take that chance. So for the next few weeks, we're asking people of Dublin City and County to take particular care and to follow what are essentially the 4 W's. Not to welcome any more than one other household into your home, and the same applies to when you're socialising outside of it. To wash your hands. If you can't remember how many times, or if you can remember how many times you've washed or sanitised your hands today, it's because you haven't done it enough. To watch your distance, to try to keep at least 2 metres apart from people at all times as best you can, and where that's not possible, to wear a face mask or a face covering. This is September, the month in which Dublin usually shows the country what we're made of, and that's what we have to do now. We can flatten the curve in Dublin again, and in doing so, protect the rest of Ireland from its spread. Last spring, when faced with an unprecedented crisis, we came together as a country, and we were at our best. Today's ask from government is even harder. We're asking people to see this through to the end, however long it takes, no matter how heavy the burden, and to do this for each other. Thank you very much.
Thank you. Stephen?
Thanks, Taoiseach. We've been dealing with COVID for 6 months now. Chapter 1 was about closing the country down in order to flatten the curve, and we did that. This is Chapter 2, and Chapter 2 is about keeping the country open by suppressing the virus. And that's what this roadmap is about. It's about reducing the ways the virus spreads in order to protect lives, in order to protect health services, in order to keep schools and colleges open, and in order to protect many, many jobs right across the country. It's been a really tough year for so many people, and during times of worry and fear, we come together. But because of COVID, physically we've had to stay far more apart than we want to. But we have nonetheless pulled together, cancelled plans, put milestones on hold, done the shopping for our neighbours, used new technologies, run clubs and run businesses differently in a world with COVID. What this time has proven again and again is the strength and the resilience of the Irish people. Our healthcare workers have been quite extraordinary. They've worked tirelessly in recent months to care for patients and to keep health services open. GPs have done amazing work in our communities. Our doctors, our nurses, our allied healthcare professionals, and everyone else who works across the system has stood up when their country needed them to most. But nonetheless, COVID is continuing to have a very big impact on our health services. It's now taking us longer and costing us more to do less. And because of this winter poses the biggest challenge to our healthcare services in living memory. In response, the government this morning agreed to an additional winter support package for healthcare for €600 million. A detailed plan will be launched in the coming days, but what I can say now is that the winter plan has been designed along Sláinte Care guidelines. It aims to do 3 things: to care for people in the community as much as possible, to add capacity to our hospitals, so for those who need to go to hospital, they can be treated as well as possible, and to provide pathways back into the community and back into the home for those who are discharged from hospital. Measures will include more home care hours, community specialist teams, access to diagnostics for GPs in the communities, community assessment hubs for people with respiratory issues to keep them out of the hospitals, additional beds, critical care beds, hospital ward beds, rehab beds, and community beds. Critical services, including cancer screening and cancer care, will be supported. The flu vaccine will be distributed very widely and for free to all at-risk groups, including children under 12. Several thousand people are now being hired to run the testing and tracing system, which we're going to need through the winter. Yesterday, the head of the World Health Organization warned that Europe is facing a very difficult time in the coming weeks and the coming months because of COVID. Today's roadmap gives us a way to navigate that very difficult time. Because of the efforts of the people of Kildare, Laois and Offaly, we now know that when we follow the advice of our public health doctors, when we move quickly and when we move locally and when we work together, we can suppress this virus, we can reopen businesses, we can reopen society. In the coming months, that's exactly what this roadmap is going to help us all to do right across Ireland. Thank you.
Okay. Any questions?
Sandra Hurley from RT News. Taoiseach, you've said there that every county is going to be on the same level, on level 2, yet there are all these additional measures for Dublin, and we know that the situation is worrying. Is it not confusing at the get-go to have that differentiation for Dublin, and why is it not on level 3?
Well, effectively, Dublin is on level 2, the new level 2, with some modifications, because obviously NEFIT gave its advice as we were in transition from the first chapter to the second chapter and this particular plan. And the addition is in relation to the pubs not reopening, but and the issue in relation to attendances at sporting events at certain stadia. The recommendation in terms of the households is in line with the new level 2 that is recommended and that has been adopted by government. Moving to level 3 is a very significant decision, and be under no illusions about that in terms of the impact of certain sectors of society and the economy. NEFIT have advised these measures to government today. They gave us that advice. NEFIT will be meeting again on Thursday, and NEFIT may very well provide further advice to government for decision making in relation to Dublin. The Dublin situation is worrying. We discussed it with the CMO yesterday, and clearly the numbers are going in the wrong direction. So we're very concerned about it, and that's why we're appealing to people in terms of their personal behaviour, in terms of household gatherings, to keep them to the absolute minimum, reduce your contacts, and adhere to the public health guidance in order to try and avoid getting to a level 3 situation, which is very significant and has a very significant impact on people's lives.
So, sorry, just to clarify on that question then, so this level 2.5 or this level 2 and a bit, is it unique for Dublin this time, and every other situation will be one or the other?
It's because NEFIT had to give advice at its meeting last week. We hadn't adopted the plan yet, and that was the nature of the advice which we've decided to accept, because we didn't want to be waiting for further advices on Thursday.
So we're not going to see, if another county had a rise, we're not going to see 2 and a bit, it will be 2 or 3?
No.
Okay.
We now have the new plan is now adopted as of today, okay? And that will apply from here onwards.
And could you just outline then, what is your new criteria exactly going to be, so people have a certainty of when they're perhaps getting to the point of moving up a level? What are you looking at very specifically in terms of that, of jumping between zones?
Well, that is, again, there's a whole range of measures that's specified in the plan. I think it's page 15 of the plan, about 8 to 9 measures that NEFIT will consider, ranging from the actual number of cases per 100,000 to the R number, in terms of the transmission of the virus, to hospitalisation, to ICU, to a range of measures that's in the plan itself, and it's all clearly set out. As to the criteria that NEFIT will use in order to deciding whether to move from level 2 to 3, level 3 to 4, level 4 to 5. And it's flexible in that regard.
Firstly, how often will the review be reviewed, or the plan be reviewed? And secondly, just returning to that question, I mean, we've been hearing for a week now that Dublin is markedly worse in terms of incidence of the rate, in terms of the trajectory, than the rest of the country. Ministers have been saying that for a number of days. Is it not confusing for people to hear that there is a distinction between Dublin and the rest of the country from ministers, yet when the plan is unveiled, to find that they're all on exactly the same status and there doesn't seem to be
No,
that
sorry.
much of a difference between them.
Yeah, we followed advice from NEFIT in relation to today's decision in relation to Dublin. NEFIT will meet again on Thursday to provide further advice in relation to that. That is the position. And NEFIT were anxious that the pubs would not reopen on the 21st. That's the main key difference, it seems to me, along with the matches, that the household advice from NEFIT is in accordance with the new level 2. So I think that's, given that we are in transition from the first phase of dealing with COVID to this more longer term plan, which is a 6-month plan, that is to give clarity over time in terms of what each level will mean for people, for different counties, or indeed nationally, and also the objectives and the principles that govern that, which is about protecting people's health, also maintaining, reopening society in terms of schools, creches, higher education, and also then looking at economic resilience, maintaining and supporting employment, and also then building up our mental well-being and community well-being through intervention by government on a number of fronts.
From the Irish Examiner. Sorry. What would you say to the people in the Midlands who endured a much harsher lockdown when their numbers per 100,000 of population were a lot lower than Dublin, when they look at Dublin and say, why is Dublin unique?
Well, I think again, the public health specialists will tell you that you can't actually apply one county to another county. There are different variables involved. So the situation in the Midlands was quite different in terms of how the virus was being spread than it is actually in Dublin. And NEFIT has provided the advice to government in terms of the measures to be taken in respect of Dublin, and will continue to provide advice to government. So it's not about putting one against the other here. It's about taking the public health advice as it's presented to us and acting on it, which we have done. And also then, obviously that will evolve. We now have a new plan in place as of today, which provides the framework within which NEFIT will advise government into the future in respect to the transmission of the virus.
Business Post. Could you just talk us through the amount of fans that would be allowed through to big sporting events in Croke Park or the Aviva? We're hearing about 5,000 supporters. That was the speculation anyway in the days leading up. If that's not the case, please. And also then, just even with fans being allowed into games, is that an acknowledgement that you regret the decision to ban supporters being allowed into games? That was obviously a very unpopular decision. I know now there's going to be an oversight committee that will look at NEFIT's recommendations. Perhaps this is one of the reasons why that's happening.
Well, look, all of the details are in the plan itself, and we learn as we move along. Let's be clear, in the actual plan itself is still quite limited in terms of stadia over 5,000, for example, that we would allow at level 2 in relation to sporting events. Some fans to attend, up to I think 200 in that regard in level 2, and a higher number in level 1. There hasn't been any discussion around 5,000. Just want to clarify that. But that remains to be, in terms of larger events or sporting events towards the end of the year. There will be ongoing engagement between NEFIT and the various sectors involved as to potentially, what could happen or what might be organised for a bigger event, but nothing specific in terms of numbers on that. And do you regret the decision? Well, sorry, that decision was in line with public health advice. Yeah, exactly. And personally, my position on sport is fairly well known. I would have loved to have been in a position not to have to make that decision. I haven't seen a championship match this year yet. I would love to see a championship match where, and there are many people in that situation across the country. I'd love to go to a soccer match and so on. We're now allowing that opportunity for a limited number of people, and I think we learn as we move. But again, even as we're allowing it, people do have to adhere to the conditions attached, to the guidance that goes with that, both going to and from the venue, not congregating at the venue, and keeping your distance, physical distance. All of that still applies. Well, I think in my view, this is a better position than the one we had adopted. That said, we, as I consistently say, you do learn from previous actions, and I'm sure the public health consistently goes back over what works and what doesn't work. And I think given that this is over a 6-month period, like the earlier decision was over a 3-week period, this is a 6-month plan. So we wanted to make sure that there was, in the various levels, if you like, clear indications to people that, if you're in level 2, you're in a better position than if you're in level 3. And if you're in level 1, you're even in a better position again. Kevin?
Good afternoon. It might be a little bit early to talk about Christmas, but a lot of people will be making plans around now. People will be deciding to come back to Ireland, who've emigrated or live outside the country. Now, even in the best case scenario, only 3 households can visit someone over Christmas underneath this plan. Will you rigidly stick to those guidelines, or will there be some sort of exemption maybe for the Christmas period for people? And then just separately, could I ask, on the over 70s, this plan is to give clarity to people, but once again, the over 70s are being left behind, and it simply says specific guidance will be provided under the section of each part of the plan on over 70s. I was wondering, when will that guidance be issued?
Well, first of all, in relation to Christmas, look, this is a 6-month plan. This is the plan that applies. We will see, obviously, how we progress over the next 3 months. And I think if we all work collectively and together as a people, we can get the numbers down, control the virus, and then we'll see what will happen in that scenario. But it's a 6-month plan, and we want to bring clarity over that 6-month period, more broadly speaking. So we didn't discuss Christmas today, and we discussed the preparation of this plan in terms of the 6-month framework. And you're correct. This framework for many people will be challenging in terms of their personal relationships, engagement, with people in other households. There are limits here. You're quite correctly pointing that out, and I would acknowledge that in terms of the numbers of visitors to your house and so on, and that has implications for that period as well. But again, as I say, if we can make progress, that's the key. You see, the more progress we make, the better we can adopt. Sorry? No. Look, as of now, this is the plan for the 6 months. We haven't discussed individual events in each of those months, specifically in the way that the question might suggest. On the over 70s, it's very clear to us that the over 70s are adhering probably better than most to the advices that have been given from the outset of the pandemic. And what we're building in here into the plan is a degree of discretion in each specific level that NEFIT will apply, and NEFIT will come back to government with specific advices at level 3 for the over 70s, at level 4 and 5. Overarching all of that, of course, is the exercise of personal judgment in relation to people who are over 70 and the need in particular to protect themselves, which they are doing and have been doing, I think, consistently from the outset of this pandemic. Do you want to come in on that, Stephen?
Yeah, look, I think, Philip, for anyone who is vulnerable to this, be they over 70, be they somebody with a chronic disease, they are more aware of what is needed than anybody else. And we know that there is a huge level of compliance with what the public health doctors are saying keeps people safe. We know that because of the way of the age groups where we've seen the infection over the past number of weeks. So all of the measures for all of the levels apply to all age groups. So people over the age of 70 or people with chronic diseases, people more vulnerable to this, they may be immunosuppressed. The same guidelines apply. What we're doing, I believe, is quite respectful and acknowledging that people who are more vulnerable to this are already applying their judgment. When additional public health advice from NEFIT would be useful, that can be and will be provided. But essentially what this plan recognises is that people who are vulnerable to this have been taking every precaution and have no doubt will continue to do so.
Sorry, Christina from the Journal.ie. I'm just cognizant that, Taoiseach, when you were in opposition, when this pandemic first emerged, you spoke a lot about people working together and you had concerns early on about divisions within society. I was wondering, given the protests that had happened over the weekend, did you have a comment to make on them, and perhaps how they could be addressed, or perhaps the divisions that are emerging within different groups in society? And second, just on the travel issue, you spoke about the European-wide model. When is that coming into effect? Does that mean that the green list as of now still stands if people were travelling, or when exactly will we have a bit more clarity on that? And also on the sports events, is there anything on things like music, concerts, comedy nights, things like that, other than sporting events? What's sort of the future for that? And sorry, I'm piling on a few questions, but NEFID as well, there was talk about perhaps having a different stakeholder group. Are we looking at an end to the daily NEFID briefings, or where is that role going to be, I suppose, in this, the wider plan?
Yeah, quite a number of questions there. First of all, people have a right to protest in our democracy. And I think the point I would make is the vast, vast majority of the Irish people have adhered to public health advice and to government advice since the onset of the pandemic. That has to be said, and I think there's been a tremendous national spirit that we've all have to acknowledge. It's fantastic to see. 6 months on, we also acknowledge that people are fatigued, they're tired of the virus, they're tired of the restrictions it has on their lives. They want to break out, and meet again like we met before. You're asking yourself, is there 6 in a pod, and if the 7th person comes along, are we in trouble? These kind of questions are daily questions that people ask every day. So we understand that. And what we're saying to people generally, we're actually managing as a country to keep this virus down, relative to quite a number of other jurisdictions. But it's a longer haul than perhaps we might have thought originally. And we have to keep at it. And we will get there. This will pass. And we will get out to the other side. But the key principles that must inform all we do, and all the measures, and there's lots of detail, and you can cherry pick one thing against another thing, but all of it combined is about one thing: to keep the virus down, to protect health, lives, and long-term damage to people, to look after our children, that they can be at school, and our younger people in college as best we can, to keep the economy moving, to keep as many enterprises as possible intact and viable for the long haul, so far as we can, and all our budgetary policy and so on will be devoted to that. That is our objective, to try and maintain and support the mental health of our people and the community well-being. To those who protested last week, it's the aggression of the protest I would have deep concerns about, and that should stop. You don't need to be in other people's faces about your opinion. You can have your opinions, you can have your views, but there was an aggression on display which I did not like in some quarters last week. I have no issue with peaceful protests, but I think they should be at that, and I think we all have our viewpoints. We don't need to aggressively impose them on others. In terms of the travel, I said earlier that the normal precautions list in the Department of Foreign Affairs will be updated now in accordance with the new European proposed framework. So new countries now will be added. The Department of Foreign Affairs will give you the details of those countries, and some will be taken off. Pending the finalisation of the European Union's Commission proposal on travel. We expect that to be around the 13th of October at the General Affairs Council meeting. Different member states are feeding into that right now. But broadly speaking, we think from a communication perspective, it makes sense to align ourselves with that, which is based on ECDC, European Centre of Disease Control metrics, and the proposal has emanated from the European Commissioner on Health, Justice, and others, which I think gives it a credibility in public health terms that has been absent to date on a pan-European Union basis. Yeah, there are provisions here for live music events, and again with conditions attached. We are very conscious of that, and Minister Catherine Martin in particular has been raising these issues with us, so we're all open and disposed to that. And again, we want to see how through various measures that, particularly in the forthcoming budget, we may be in a position to support people in that sector, be it the sound technicians, be it people who normally would have had a lot of gigs on and would have been organising for it, now have relatively few, And again, we need more nuanced measures around the PUP plus for people who could be earning and so on. So we're looking imaginatively at ways we can continue to support the arts and live performance within the limitations of COVID itself. In terms of, there will be the ongoing NPHET briefings, and also we're also going to continue engagement with stakeholders, which is very, very important, that we maintain our link with various sectors of society and the economy out there who can feed back to us their sense around the practicalities of many of the measures that have been advised. And indeed, there was some degree of consultation as well in advance of the publication of the plan by our officials with different sectors, because we are focused on what will work.
Taoiseach, can I just bring you back to the treatment of Dublin? If I understood you correctly, you said that you've adopted these 5 levels now, and that is a government decision, but that NPHET recommended an adjustment based on the particular circumstances of Dublin. I hope I'm understanding you correctly. But you've also just said that different counties have different circumstances and that you can't apply a blanket approach to each one. So what's to say that NPHET won't come along at some other point in the future and decide that one of the 5 levels needs to be adjusted for an individual county? What's to say that NPHET couldn't come along in the future and say that, well, a county should move to this level, but with some adjustments? What's to say that this plan isn't going to find itself modified?
Because this plan has now been adopted today. That's it, as of now. I mean, NPHET...
But if NPHET could come along and say that different circumstances pertain in Dublin than they do in Laois or Offaly...
No, the different circumstances, relates to... That's why you have in page 15 of the plan the 7 or 8 variables that will inform NPHET in terms of the advice to give the government as to when to trigger moving from one level to another level. So it's a range of criteria, such as the numbers per 100,000, along with hospitalisation, another whole range of other measures. Yeah. And just on that, just for fun, I mean, it might be worth your while talking to CMO about this, because because they did say to us yesterday, sometimes you see figures and they give a sense or they give an appearance of, the transmission of the virus, that it may not be, once you get under the surface, the actual case. So you can get local, Stephen will come in here as well, you can get local anomalies that raise the overall numbers, but actually can be controlled in terms of normal public health measures. Stephen?
Thanks. So it's important to remember that moving from one level to the next is a serious thing to do, right? For any county. This isn't about Dublin versus anywhere else. Moving from level 2 to level 3 has a serious impact on jobs. It has a serious impact on how we can live our lives. So within any given level, NPHET will quite properly offer advice. So level 2. What level 2 says is that we can have up to 6 visitors to our home or garden from 1 to 3 other households, right? That's level 2. And on that, NPHET is saying, for Dublin, because it is moving rapidly in a bad direction, just keep it to 1. Rather than having 6 people from 3 households, just keep it to 1. There's no requirement on travel restrictions in level 2, nor are there any travel restrictions being put in place for Dublin. But NPHET are saying, within the current trajectory, Dublin is at level 2, but be careful. So if there are meetings you are going to have, you're going to meet up with people that maybe you don't need to meet up with, don't do that right now. The one exception is the wet pubs, and that really is less about creating a level 2.5 and more about recognising that we are currently transitioning from one model to another, and that NPHET's advice, given where Dublin is, and given that nobody wants Dublin to move to level 3, the advice is just for the moment, just keep that as one exception.
Sorry? Well, again, I mean, as I said to you earlier, you've got to look at the we can't cherry pick one particular provision and set it against another. The overall issue here is a combination of measures work to try and keep the virus suppressed and down. And public health advice has fed very strongly into this across the various levels. And as we were in transition from one phase to the new model, NEFIT gave this particular advice in respect of Dublin and the wet pubs because of its concern in terms of the trajectory of the rising numbers. NEFIT will be back to us on Thursday with further advice in relation to the Dublin situation.
Yeah, and remember, that's it, Sean. But remember, the one around people visiting our home isn't an exception for Dublin. Level 2 says have no more than 6 people over to our home or garden, and keep that from just 1 to 3 other households. And NEFIT's advice to people in Dublin right now is just keep it from 1 other household rather than from 2 or 3 other households. And you know, Sean, a lot of friends living in Dublin, we're all watching what's going on in Dublin. The people of Dublin understand that the situation is escalating very, very quickly. And people in Dublin, I think, welcome the public health doctors providing this advice. Yes, it's within level 2, but the public health doctors are clearly saying, we all know the situation is deteriorating, so the best way to slow down and ideally reverse that deterioration is, rather than having people from 3 households, just have them from 1. So that's it.
Fehef leis an plán seo le fada táinteamh tris fethe caintear cécho táchtach agus atá sé ag meach plán sa léir going don chéad tréimh se eile amach roing. Ach tuisc na ceistena tá cloiste going in seo in ómh margheall tá míad levéile dó ar fud na tíre ach tá bleach líosáis levéile dó plus é seo agus plus é siúd. Bhfuil an buil an bhfuil bíad rás go dtín rud se margheall tachtreachtaí meascathe a chur amach an rialtas agus nach bhfuil sé sa léir don pobl calg ba chórdóibh a déanamh.
Is plán cuimse hoc é seo, plán ina bhfuil anna hiléir ar fad ó héh na sémíine atá le tacht. Is plán atá bhaiminis de bhar cinenne an rialtas ar feig sémíine, sémísa agus mar aon lei sin sé atá gceist sa phlean nóir muinte na tíre chamáid slán agus an damáiste atá a dhéanamh ag an vírus corónach a íslú chofada is féidirling, cuasaíach na míochta agus fostíochta a chamáid slán, na scolanna a chamáid ar oscailt agus an tríú levéil agus an sin ar fud na tíre takeíochta chóirt as na balte éagsúla chun cara chóirtó dóibh daileáil leis an vírus corónach seo. Sin bun agus bar an phlean seo. Agus ní léon bhhéilán madidir leis an ceiste cuirtú ó héamh lá clia. Mar go bunúsach sé tá gceist an lá clia, tá sé fós le bhéil dó ach amháin ó héamh na tithe tarnaide agus na cluichí. Sin agus cén fá mar de thug NEFIT chomhla doing I rit na seachtainna se chatte, ní raibh an phlean nua chur a bhaimimeing nuair a formar an cóirla sin, bhí mar sásta ghlacha leis an cóirla ón NEFIT, beag NEFIT ag bailú le chéile ríist der dín seachuing, gan áras beag níos mó machna bhá dhéanamhacha ar bailíoch lia, agus beag cóirla beidir ag tacht os cóir an rialtas an tacht an seachuing I ggóhéics son. Sin tá sé réúnta simplíonis agus caiigh gachéine is sin admháil in áiríre. Well, ní féidir mé sin a bheits an nómh breithin sé ar na himhreacha agus na nithe eile a bheith ag scrúdú ag an CMO agus ag NEFIT agus go háirithe an scéal fá téirmeach ó théamh na figúirí de agus gan áras beag NEFIT ag déanamh mac na bhir sin.
With COVID. At the weekend, the Irishman on Sunday reported that NEFIT are feeling very fatigued from sources in there. Yet we also learned that both yourself and the Taoiseach are receiving different briefings from the acting CMO. Given the stress that they're under, is the least two of you could do not agree to have joint briefings from the acting CMO?
Quite frankly, I thought that was a ridiculous assertion. We get joint briefings at COVID committee meetings. We were with the CMO yesterday, all of us, the three leaders, plus Minister for Finance, Minister for Public Expenditure, Minister for Health. Now, I do ring the CMO. I'm sure the Taoiseach rings the CMO now and again. Not for hours, by the way, as the story alleged. I've never had hours of briefings from Ronan Glynn at all. But as Taoiseach, I do think, if on a Saturday I'm somewhere and I want to check up on the numbers and what's Ronan's read on the numbers, very often the phone call is quite a brief one. I'll ask him, anything jumping out at you here in terms of these numbers? That's, I think, normal and natural for a Taoiseach to do that, to be on top of it with the CMO, to get his feedback. And I'm sure he doesn't mind that at all. And, so I was very surprised at that assertion by the person who made that. Don't know who the person was. But it's not inaccurate or in tandem at all with the truth. That's not what happens. And so I have to nail that now, There's a level of stuff I'll take, but not that kind of stuff.
Just to back that up with the facts, the Taoiseach and I are briefed together very often with the leader of the Green Party as well, as we were yesterday at a Cabinet subcommittee meeting by the CMO. In the 80 days since this government has been formed, I had an individual briefing with the CMO on 2 occasions. Once was a half-hour video call last week because I had some questions, and the other was with Philip Nolan when I had some information I wanted to understand about the modelling. So roughly once every 40 days for half an hour.
This is about the nation.